We are proposing better, simpler health care for all Utahns, financed fairly for everyone.
I'm Ben Winslow on Utah's Capitol Hill. A citizen ballot initiative has been filed here that could completely rewrite health care coverage in Utah, but it's got some big and potentially expensive hurdles to clear.
What we will replace is the out-of-pocket money.
Dr. Joe Jarvis says he's seen the impacts of healthcare costs on people's lives.
People are afraid to use the healthcare system because they're afraid it will bankrupt them. We'll take that fear away.
The physician is sponsoring this, the Utah Cares Act.
We will replace that out-of-pocket money and the money that comes from private employers with what we're calling the Utah Cares Premium. It's a brand new way of raising revenues in Utah. It's never been used, at least in the sort of scale that we're trying to propose it.
It creates a single-payer system in Utah to provide health care coverage. It would basically take the public employee health plan currently offered to state employees and expand it to everyone. It could also replace employer-provided health care benefits.
We're going to save $16 billion and eliminate from the employers all their costs. They don't have to buy a health benefit anymore. So that saves a big chunk of money right there for our private businesses. It saves all the money that comes out of your pocket.
The cost is a big factor in this. It would impose a 2.85% tax on Utah businesses. The Lieutenant Governor's office recently rejected part of the initiative, saying it falls about $8 billion short. The group plans to appeal, questioning the math.
It's a very reasonable, very functional way of approaching the healthcare system. It's just radically different from the way we do business out.
So far, many Utah healthcare groups are taking a wait-and-see approach to see if it actually qualifies for the ballot. In the past, the American Medical Association and some conservative groups have opposed single-payer systems.
It is not too late for the thousands of Utahns who cannot afford the health care they need.
Efforts to create a system like the Utah Cares Act have been underway for years. These people shared their stories at a 2023 event put on by the group Common Sense Healthcare for Utah.
No one should be faced with this kind of choice, especially when it's forced upon them by the bureaucratic policies of an insurance company that's more worried about their profit margins than people's health.
So the Lieutenant Governor's office reviews all citizen ballot initiatives for constitutionality and fiscal impact. Like I said, the sponsors of this one plan to appeal the math that was used. If they are successful in their appeal, they would then be able to hold a series of public meetings and begin gathering signatures for the 2026 ballot. On the Hill, Ben Winslow, Fox 13 News, Utah.